This is Michael, host of the political podcast, Cuckoo for Politics. I am so passionate about politics, hence the name Cuckoo for Politics, and I hope you are too. Thanks for joining. This is a podcast discussion on political perspectives on various issues that matter with citizens of the world. So I do ask that you grab your favorite libations, whether it be coffee, tea, water, juice, beer, wine, or a spirit or two, and let's get ready for some lively conversation and let's learn something together. What's up, good people? Welcome to another episode of Cuckoo for Politics. Today, I'm going to be talking about breast cancer, not just as a medical condition, but as a story of survival, access, and inequity. Now, you might be wondering, why are you talking about breast cancer now? It's not even October. Correct. October is the month that's globally recognized to bring awareness about breast cancer, hence why many people often wear a pink ribbon to raise that awareness. However, let's be clear. Breast cancer is a disease that affects 1 in 8 women in the United States alone, and it touches on every member of a family member in some way. Hence, the title, Beyond the Pink, is to continue to discuss the matter even beyond the dedicated observant month of October. Because in truth, cancer or any other type of disease is not isolated to 1 month. But here's the thing. Who survives and who struggles isn't just about biology. It's about race. It's about occupation. And it's also about healthcare access. Today, my guests will bring all those threads together. Joining me are 2 remarkable women, both flight attendants for a major U.S. carrier, and both warriors in their own right. My first guest is Kimberly Burckhalter. She resides in Los Angeles and is a 32-year veteran career flight attendant. She was just recently reelected by her peers to serve another term as the Association of Flight Attendants CWA local council president, representing over 2,000 members in Los Angeles and in San Diego. She has an extensive career in advocating for labor rights. One of the main things she's known for is lobbying Congress in seeking better health protections in cabin air quality standards, crew rest mitigation, and crew rest improvements. But for the purposes of this conversation, she's a 25-year breast cancer survivor. Yes, 25. Amen. Derrian Aversa is my other guest, and she's a 40-year flight attendant whose career has taken her all over the world, 10 times over, too many countries to mention. She resides in Melbourne Beach, Florida. In addition to being a mom, as well as a wife, she's a realtor for over 10 years in the business. She was recently diagnosed with breast cancer last year, and I'm happy to report she's successfully beating it. Today, we're going to talk about their challenges, their journeys of being on the front lines in the air, and what lessons they have learned about survival, awareness, and the politics of healthcare. Ladies and gentlemen, welcome to another episode of Cuckoo for Politics. Let's get ready for some lively discussion while learning something together. Cuckoo for Politics is available on most popular podcast platforms, such as Apple, Spotify, and the Cuckoo for Politics YouTube channel. Hit the like button and subscribe so you won't miss an episode. Past episodes can be found on the website, cuckooforpolitics.com. I will add links to those platforms and to my social media accounts, like on Facebook and Instagram, in the show notes below. Feel free to comment on either of those platforms, as I welcome all feedback. Appreciate your support. Take care. What's up, good people? Michael here, host of the political podcast, Cuckoo for Politics. Once again, thank you for joining and thank you for listening. First of all, Kim and Derrian, thank you for joining on another episode of Cuckoo for Politics. Thank you for your support. Let's just dive in. Kim, I've known you the longest, so I'm going to start with you first. I've known you since back in the days of JFK, but that's how long we've been known as a friendship for such a long period of time. Tell me about your story. What was it like?
Thank you. I remember babysitting your cats
Yeah,
on vacation.
That's true. That's true. Again, we'll go way back to our viewers and listeners. And I, like I said, have been gone back for a long time. I remember you house sat at our little trailer park when our house fire went down, and we were away taking care of family business, and you came and house sat our our little cat. Oh, yeah, moment of time, moment of time. But you tell me about yourself.
Well, I was diagnosed. I'm just going to jump right in.
Okay.
I was diagnosed officially on July 2000. And I found the lump myself on the 4th of July. I was on a trip heading back to New York and I was getting ready and I felt a lump, small lump, like the size of a pea, just right under my right breast. And I didn't think anything of it at that time. I was talking to a friend of mine and on the flight, and I said, "Yeah, I felt this lump. It doesn't hurt or anything." And he was like, "Well, I think you need to go get it checked out." So I said, "Okay." So I went to one doctor, and because my regular doctor couldn't see me at the time, and he was saying, "Well, basically, because of your age, family history, you don't smoke.
How
It's
old were you
probably."
then?
At that time, I was 33. I was so yeah, 33 at that time. But he was saying it was probably a cyst. So I'm thinking, okay, it's a doctor. He knows best. So I remember the next day going to see my hairdresser, Derek, which Derek. And I told him exactly, can you tell your hairdresser everything? And I told my hairdresser what was going on. And he was like, I don't feel comfortable about that. Let me make a phone call to one of my clients. And she was able to get me in to see Dr. Peterson, who was at Beth Israel on the 10th of July. And I went there. He felt it. He did a needle biopsy, said there was cancer cells, sent me down to the fourth floor to get a mammogram. And while he was doing that, he called my hairdresser to say that I was by myself and that I needed him to be there, but he wouldn't let him know exactly what was going on. And when I got back from the mammogram, Derek was there. We went into Dr. Peterson's office, and basically he showed us the slides and said, it is cancer. I saw it. And the next thing that I remember him saying, because I didn't pass out, but I totally went numb and just tuned it all out. I didn't hear anything else that he said. But basically, he said where it was located, that he suggests to do a mastectomy with reconstructive surgery. And again, having Derek there, my hairdresser, he's the one with all the questions. Will she be able to wear a bikini? Will she be able to wear? I'm just like,
Well, that's good. Derek is he's still looking out for you. He knows you, and
yeah,
it's good to have that support, that person that you needed. Darren, you come onto the scene. You and I have been friends for at least probably the last 10 years. But we started talking, joking around, and since then we've become friends. Croatia. Oh, yes. On a side note, for those of you, put it on your bucket list. Croatia is a place to see. Visit definitely on the bucket list. Nevertheless, tell me about what were you going through? How did you figure out or diagnose? Was it a regular checkup or you'd felt yourself? What happened?
Weirdly enough, in November of 2024, I had a COVID vaccine and I was scheduled for my mammogram. And my doctor, well, the mammogram facility said you cannot have a mammogram for 8 weeks after a COVID vaccine because it swells the lymph nodes. So I had to reschedule. And this is this is a topic, a whole nother thing. Scheduling in these departments are horrible. They don't have enough people working for them, and things get scheduled really far out. So they couldn't schedule me until February. So I had my yearly mammogram in February of 2025. And then about a week after that mammogram, I got a phone call from the doctor's office saying that there was something suspicious and that I'm going to have a secondary mammogram and ultrasound. So I said, well, can this be a stat type of thing? And she said, well, I can put in for that. So then when scheduling called me, they said, well, our first available is August. Now, mind you, we're in February. So I had to call every single day until I finally got an open slot at a different facility in May of 2025. So from February to May, I had to wait until I could have that secondary mammogram ultrasound. And it was at another facility that I don't go to that's quite far away. So I went, they did the mammogram. I had to go, and I took a friend with me, and I had to sit and wait in the waiting room. And then they called me back for the ultrasound. So the girl starts the ultrasound, idly chit-chatted with me, stopped, went and got the radiologist halfway through the ultrasound. He came in, he looked at what she was looking at, and he point blank said, it appears to be cancer. But I'm not sure. I'm going to let her complete the ultrasound and we're going to send it back to your doctor, and you need to see your doctor. So about 2 days later, I went back into the doctor and she said, let's schedule you for a biopsy. And we were able to get that 2 days later at a different facility. While I was having the biopsy, that radiologist looked at it and said, it does appear to be cancer. But now we have to wait and see what type of cancer. So a week passes, and the first portion of the result came back with a type of cancer called invasive ductal carcinoma, which, according to my doctor, is a common cancer that women can get. About a week after that, the secondary portion of the result came back with an aggressive cancer called HER2 triple positive. Now, HER2 triple positive and HER2 triple negative are two different entities of breast cancer. The negative, they don't know what causes it. The positive, which is what I have, is estrogen and progesterone driven. At that time, my tumor was at the 1 o'clock on my left breast, and it was at a 1.6 centimeter. Small enough, because anything that hits like 2, that's stage 2 cancer. Mine was stage 1. If you're in the 3 centimeter, it's stage 3. That's how that works. So at that point, I knew somebody that was going through cancer, and I reached out to her and asked her where she was going. And she said, well, I'm going to the facility over in Tampa, Florida called Moffitt. And it is one of the top 5 cancer research centers in the United States. So I said, who's your doctor? She told me. So I called Moffitt immediately before I even had all my reports. And I just said, no, I have everything. I can send it to you. And she said, well, we don't have an appointment with this particular doctor. And I said, then I'll wait. And so I went right back to calling every single day. And then I got this wonderful person that said, okay, on June 2nd, we have an appointment with this surgeon.
Hey, out of curiosity, I'm noticing that it took some time for you to get examined and treated. Kim, did you have that same situation many moons ago?
No, I didn't.
Interesting. So you were able to see the doctor and get diagnosed and start the process?
Yes, because again, having Derek, knowing people in the medical field, they were able to get me in to see Dr. Peterson. So again, diagnosed on July 10th and had the surgery July 18th.
My birthday.
Happy birthday.
It's my birthday. It's my birthday too.
Exactly.
Well, no, I mean, but it's not, it's, you know what I'm saying. My birthday, birthday is in March, but my rebirth and my second chance, I always say, is July 18th.
Exactly.
You have, I see. It just it just clicked as far as the 2 birthday. One's your actual birth and then one's a survival.
Yes.
Is that pretty common amongst breast cancer survivors, regardless of cancer in general? Just out of curiosity.
I think so. I've talked to, many flight attendants that are survivors, and we always joke that, yeah, we have 2 birthdays.
What do you think are the reasons or causes of breast cancer? They say some things that could be on your diet. I think with you, you're both professions in the flight attendant industry. Do you think the high exposure of radiation disrupted sleep patterns? Do you think those are other variables that may be attributed to breast cancer?
Yes.
I agree. It does. And I had this conversation with my oncologist 2 weeks ago, and I asked him that very question. And he said, although there is an uptake or an uptick in airline industry people like flight attendants that he treats and he sees, the data to prove that isn't 100% yet, but they are seeing a trend.
But
Hmm.
I do remember Harvard doing a study on it, and I think some volunteers, men and women, were taking, like, I think they had like a little clip that they had to take for their long haul trips, like overseas, as well as short term trips within the United States. And they came back. So it seems like that study is still ongoing. You think it's ongoing because there's so much data, or do you think it's lack of funding? Do you think airlines in general are trying to slow down the end result because they know what they would have to do, or insurance companies?
I think that it's lack of data and funding at
Hmm.
this point. I don't think that they're slowing it down yet because there's too much controversy in it. Cancers are now becoming really prevalent. It's, besides the breast cancer, talking about environment and flying, I mean, there's a lot of pilots with skin cancer and prostate cancer. And now they're seeing a lot of flight attendants getting breast cancer. And it's not just a flight attendant here or there. It is increasing. It's increasing throughout the years.
Yeah, I have to agree. I mean, if you look at the type of flying that we do and the exposure that we're in, the aircraft, we're exposed to, cosmic radiation.
Jet fumes.
Yeah. Just a number of things, like you were saying about skin cancer with pilots, you look, they are for a long period of time sitting in the front of the aircraft with that window that they said, well, we've got sunscreen, whatever they have in there, but they're always finding on their face or the arms. Nowhere else I mean, it could be anywhere else, but a high number of skin cancers in pilots, face area, arms, hands area. For flight attendants, again, with breast cancer, it can affect men and women. It's not just a woman's, cancer. Men, it just, for some reason, we don't talk about men as much as we do women. And I also believe that we need to talk about it more. I talk about my journey, my survival with just about anybody because I always wear my pink pin.
I do too. I
You
do
know,
too.
and people, that's a really good way to get a conversation started because they'll automatically think, oh, someone in your family. I'm like, no, I'm a survivor. And they look at me and I'm like, I've been a survivor. I was diagnosed 25 years ago and I've been cancer free for 20. And they look at me and they're like, wow. And I just tell them my story that, you know, just having the right people in your circle, knowing your body, knowing when something feels off. First sign, don't wait. Get in to see a doctor ASAP. But also going along with what you were saying too, it just seems like it's just waiting and waiting and waiting. You shouldn't have to wait that
You
long.
shouldn't have to wait, and you shouldn't have to be the one that has to call every day to
Right.
for something because I find a lot of stage 3, stage 4 cancer, and I don't know how you feel about this, but I feel like sometimes people wait because they're afraid,
Yes.
of what it could be, so they kind of put it on the back burner and then it becomes too late. But also, it is the industry of the medical field right now. You cannot get an appointment for nothing. Even though your doctor says this is an emergency, this is ASAP, you cannot get an appointment. it's a
So now this seems like so many questions I'm thinking of as both of you are talking. Part of it is the treatment. I still want to go back to that and the need of support. But it seems like in the medical profession, there is, even though there's so many illnesses, it doesn't seem like there's enough medical professionals
they're
in various parts of the country. And there's a slowdown as far as getting, I can't imagine, Derrian, that what you were going through, you found out and then you're thinking about, okay, you have so much going on. You have a family, you have work responsibilities, et cetera, et cetera. And then you have that weight of like, okay, can I get somebody to see me? Just thinking about that in your mind, it's like that adds another level of stress to the whole equation.
It does. It does. And it's the what if, where do I go now? What steps do I do now? Who's going to advocate for me? Who's going to guide me?
Both of you talked about having a friend with you. So let me go back. You had that support. They were with you not in the room itself, but and during your recovery stages at every step of the way, that person or persons. I know, Kim, I was with you when you came out.
Yeah,
You
were sneaking me chicken and ginger ale.
I was
Because
your
I was like,
mule.
I can't take this food anymore.
I said, I got you, girl. I got you. Yeah, yeah.
Yeah, you and Tiki smuggled chicken and ginger ale in for me.
Yeah, we won't tell you
So,
where we smuggled it, but go ahead.
well, no, I do think that I call it your circle of friends, true friends. Because again, whenever you have any illnesses or anything that happens in your life, that's when you know who your true friends are, who's
You
going to
always
be
have
right there.
another ear, because when you go through something like this, you just kind of like check out for a minute.
Mhm.
You need that person to listen to what you're checking out of.
Right. That's so true.
And a
So
lot of times
the importance of
you
support.
don't necessarily want your husband or your wife to be there because they're as equally scared. So you know where I'm going with that? So it's kind of nice, like she said, to have that circle of friends that's gonna like hold you up there for that second.
So you're saying your spouse or relative, an aunt, an uncle, or cousin, they're too attached per se? Wouldn't you say a dear friend is attached too?
Yes, but not to the same level.
Okay. All right. I could see that. I could figure where you're coming from. Similar to like when you see a loved one, like when my mom was ill and my sister is a medical doctor, she could not diagnose my mom. She could understand, but she would have to have someone totally objective to not only explain the diagnosis, but the treatment because you're too heavily involved in that person, that loved one. And
Yeah.
it's that's tough. Let me ask you a different question, Kim, because we talked about the Harvard study and so forth like that. And you enlightened me. I didn't even think about the front of the cabin, meaning the cockpit crews, their exposure more so than us who are like insulated behind the door. Do you know if the unions are involved in this research or assisting with other government entities or the company in regards to insurance, but also to the study of the reaction of radiation?
Well, I know that the union and the company are working together as far as when it comes to insurance. Let's say with insurance, like with us getting our mammograms, the insurance is looking at that like 100%. Because we just had our cancer awareness month. We've been out walking the terminals and talking to flight attendants, giving them the card that has the QR codes that talks about the different places where you can go look into research, doing self-examinations. And the company has been really, really good when it comes to their involvement with our union. But it took a long time for that to happen, and we still have a long way to go.
Why do you think it took a long time?
I can't speak for the company. I mean, it took them a while to realize that you have a group of flight attendants, male and female, predominantly female, that we have different cancers, ovarian, we have breast cancer, we,
Prostate.
prostate cancer for the men. it took them a while to realize that we've got to take care of our employees. And I know money's always
It's
in
money.
it's money, but we have to push them along. Come with us. Let's work on this together. And just inch by inch, get them on the same side as us, working with us.
Well, you lead me to a good segment as far as introducing insurance. And one of the things that is being debated about is the Democratic Party or the Senate and Congress are trying to push for subsidies for the Affordable Care Act. My understanding that if it lapses by the end of this year, insurance premiums will go up significantly for those who have insurance and those who do not have insurance. We are very fortunate to have a union who negotiates insurance and a company that responds accordingly. Affordable Care Act has expanded screening for every level, and that's helpful. What do you think, if it does lapse, do you think it will probably be more problematic for individuals to get screening and to get treatment? Derrian, you talked about how you have insurance and the trouble you had. I can't imagine if it lapses and the industry is not there, what can happen? I mean, what do you think?
So I think it's going to be problematic because people really depend on their insurance for certain things. But in my case, there's a couple of different things that I feel are going to be problematic. I went to a facility that does trials, and they're trying to dissolve these, not just my trial, but trials in general.
Who's trying to dissolve?
Like the government, like they've already said that they're going to cut funding for certain trials and for different like medical issues. We don't know which medical issues, but these trials help a lot with breast cancer or other type of cancers. And in my case, my trial, they used my own blood, my red and white blood cells, to form a vaccine for my cancer. And that is going to go a long way. I can't even imagine this not having funding and it being taken away.
I was in South Africa and I happened to talk to individuals who were at a medical conference. They were OBGYN. They're representing from all parts of the world. And when they heard my accent, which I don't think I have an accent, but I do, they were saying that, yeah, what's going on with your country? And I'm like, well, where do you want to begin? And they were talking about the subsidies that are taken away. I did not realize the U.S., along with European allies and other countries, but the U.S. is a vast financial supporter from various administrations, Republican and Democrat, and even in Congress that have supported various these programs. And they are concerned that, Derrian, what you just mentioned, the lack of funding is going to hurt societies overall in various screenings, and not just cancer, just in every type of healthcare, and that it really is going to impact them. Not to say that local governments cannot step in, but let's be honest, United States,
these local governments can't afford to step in.
Right.
Correct. Local governments can't, or limited due to lack of resources and so forth. So that's a big concern.
I think about what Kim 25 years ago, correct? Right? 25
Yes.
years ago. And what I went through recently. I can't imagine what a woman in one of these other countries, how they get treated for breast cancer. I can't imagine. And I can't imagine who advocates for them.
Yes.
My sister shared with me, she's a survivor too of breast cancer. And she was telling me about the treatment that she got. She said now she lives in France. So I hope to have her on a podcast too. But what's interesting, what she told me, is that not only the medical treatment that she got quickly, but the medications and the treatment the doctor prescribed, and that was it. She knows a friend of hers in the States that the doctor prescribed, but then the insurance company limited the amount.
That has happened in 2 of my medications already.
And it's called money. It's money.
Did you have to fight for it? Did you have to fight for it, Derrian?
Yeah. It's like these insurance companies and, it all comes, they're playing with people's lives over the dollar. You can go to, we're very lucky to be flight attendants that we can go all over the world. And you hear and read about how it's easy in certain countries to just get a medication. The doctor says she needs it, he needs it, they get it. Here, it's like we have to jump through hoops. Is there a generic version of that? You're going to pay out of pocket, $1,000 a month. And that's on top of what the insurance is paying for.
And
it's just, they're playing with people's lives over the dollar bill.
It's the dollar. And I know in a couple of the breast cancer forums that I'm on that there are women that get a medication and their insurance doesn't approve it. So then they have to go to a generic. There's something in the generic that they're allergic to. There's some substance or something that the generic is made with that now has made them allergic to, but yet their insurance isn't going to pay for what the drug actually is. So then what do? You know where I'm going with this? It's like, just approve the drug that the doctor prescribed, because you can't take the generic because there's a substance in it that the individual is allergic to.
It is problematic. I think you always hear Bernie Sanders, he often says, we're the only country that does not provide universal health care, and insurance company has a grip on legislators to make any type of changes. We talked about insurance. We talked about the, concern if the Affordable Care Act is not subsidized or addressed, not only this year, but going forward, healthcare in general. I want to talk about something else that seems to be disparity. Kim, clarify something. Are you Black?
I would say yes.
Oh, okay.
Like this.
Oh, okay. You woke up like that. Okay. And Darren, you were white, would you say?
Last time I checked, yes.
Okay. Beautiful thing. But you know what's interesting? I find in my reading up on this, there's still a disparity between Black women are more likely to die from breast cancer despite incidence of lower rates. White women have a higher rate of getting breast cancer, but however, they are quickly treated than Black women, Asian women, Hispanic. I found those interesting statistics in this, but it sounds like depending where you're from. Kim, you were in New York, you got quickly treated. Now, again, that's 25 years ago, but New York, you were able to get seen, diagnosed, treated, et cetera, et cetera. But Darren, you were in Florida, it seemed like there was such of a hiccup that you couldn't even get treated.
It's exactly lack of professionals.
Yeah, so it seems more or less not necessarily in this case, not necessarily race, but also I think the accessibility based on the amount of medical professionals living in various parts of the country.
So there are nurses that live where I live, and they travel an hour plus to Orlando to work in the Orlando hospitals because they get paid more there than they do here, which is unacceptable.
Now we're talking about pay equity. That is also a factor, which would make sense in a sense of New York. Definitely they pay their workers more so due to cost of living. And Florida, I guess, depending where you live, what city you live. I would think Miami and so forth.
Why would a nurse an hour away get paid $20,000 more a year, and they live 1 hour away and they do the same job?
Same job. Yeah. It's again, here you go with the money. It should be the same across the board. Doesn't matter if you're in a small town or a metropolitan city. You're qualified. They just need to pay, the doctors and nurses better. It's just.
And it's getting challenging because of hospitals are merging. And when they do merge, when corporations merge and so forth like that, there are some benefits, but there's definitely some deficiencies. And one of that is layoffs or we're not going to pay you X, Y, and Z. Or if your hospital is unionized, they're going to do everything they can to break up that union, because
Yeah.
we already know statistically union workers get paid more. They're compensated more than non-union workers. That's why there's such a big struggle with corporations and the legislators that they control. There's always a battle between the two. I would ask two things. Kim, what gives you hope? You've been in it, 25-year veteran. What have you seen, if you've been following, especially with group settings, what gives you hope about the treatment and as well as the support that you see that has transcended?
Well, it's amazing to me. Let's start with treatment. What the surgery that I had 25 years ago, they have totally improved and changed and everything. I mean, when I had my mastectomy, basically what they did was cut around the areola, removed all the breast tissue with the areola, still connected, removed all that. Then the plastic surgeon came in, put expanders in. Every 2 weeks, I had to go into his office and get the saline to expand, have another surgery, to put the implant in, and to have a nipple rebuilt. Having reaction to the implant. Altogether in 25 years, I've had 7 surgeries, and I've had lifts and free tram when they take the muscle and tissue from your stomach and they build you a breast. What's going on right now is that I have an implant. But right now, if this would have happened to me now, I don't think that I would have had all those surgeries, because the advancement, I mean, 25 years, a lot has changed. Now with the surgery, they're able to, save the nipple, the areola. They're able to, uh, you know, just do a total different surgery than what I had.
In less time, it seems like.
And less time. Exactly.
Darren, tell me your experience.
What she's saying, the type of surgery she had, they'll let you go home in a day now in today's society.
But back then, no, I was in the hospital for a few, there was my free trim. I was in the hospital for a whole week.
They move you in and out.
So,
Yeah.
Darren, your experience is a lot different.
Yeah, mine is a little different. I ended up having a lumpectomy because of the size and where it was located. And they went through my armpit to be able to remove it. And then I had another suspicious area that they went ahead and was able to get to and remove that as well. The unfortunate thing is they removed one lymph node, and that lymph node was positive. So then there was the question of when I start radiation. So they agreed that I needed to go in and have 17 more lymph nodes. Well, I say they didn't count them out. They call it a pod. So they agreed to go in and remove more lymph nodes. At that point, I was like, well, would it not be recommended if I just do a mastectomy? And they said, no, it's not necessary at this time. So they went in and they removed the pod of lymph nodes, which ended up being 17 more. They went right through the incision that they used the first time. So there was no other additional cutting, and they were all negative, thank God. But now I don't have like a lot of feeling in that area, which I probably won't get back. And then I had to do the 20 rounds of radiation right after. Now, that was not elective. That was like I was told, because of the type of cancer that I have, this is what you really need to do. And so that's what I did. I followed my physician's recommendation. But I have talked to people like Kim that's had what she had done and what she's saying that she had done. And I agree with her. I don't think she would have had to go through what she had to go through now, versus 25 years ago. In that respect, it's amazing how medicine has come forward. But in the same respect, listening to her, a lot of it's standard and it's still brought into today's society, which is kind of interesting.
What would you say to someone who's listening or watching this podcast, to someone who's going through it? What would you say to encourage them, not only to get the treatment, but also encourage them to stay on, to have faith? Either
Kim?
one, either one.
I always say early detection. You know your body. And if something feels off, don't wait. Just go to your doctor, let them know, hey, I'm feeling this. I need this to be looked at. You have to insist. Because again, they'll look at your age depending on, like I said, I was 33 years old. I didn't smoke. There was no cancer in my family history. And very quick to say, it's probably a cyst. I know now, as I've gotten older, probably is not going to be the answer. You will do this, you will do that, or I will find somebody to do it. I will not take a no for an answer. And I think that you only have this one body. You got to take care of it. It's a temple. And if someone is telling you that it's probably nothing, you go see somebody else and make sure, you just can't let somebody tell you you know, how you're supposed to feel.
And I agree with her in that respect. First off, I love the word "your body's a temple." That's
It is.
that's a great
This
word.
is it. We're only given this one body, and we're supposed to take care of this. And again, things happen. You and I, we did what we're supposed to do. We took care of it, and we're continuing to take care of our bodies.
So I sat in the waiting room enough through this last year to look at the women that were sitting in there. And I can't tell you how many women were in their late 20s and 30s and 40s. They don't pay for a mammogram until, or ask you to do a mammogram until you're after the age of 40, which, I'm sorry, that's not acceptable. When I
Mm-mm.
can see that many women that have breast cancer and therefore they think that, well, okay, I don't have to have a mammogram until I'm 40, so I'm not going to get breast cancer. Well, anybody can get breast cancer.
Yeah.
And, if you look at young girls with our food, the way our food has come about, they're getting breast by the age of 12. And
Exactly. Yeah, you're right about the food.
hormones. And so I disagree with the 40, and I agree with Kim. You have to advocate for your own body. You have to be aware of everything on your own body to understand what this is or what this is not.
Yeah.
And it goes right back to the money.
Yeah.
They won't pay for a mammogram until you're 40.
You guys hit it's all about the money. The food intake, that's another podcast discussion right then and there, as far as, and the need for early detection. I would say too, men have to be more aware if they have sisters or brothers or a wife, a spouse. Uh, Growing up with four sisters, a mom, a dad, I'll have to say I had to be aware of these things, and I'm still learning because you're right, it happens to all of us. Cancer does not discriminate.
It does not.
No, I say that all the time. Cancer does not discriminate. It doesn't care what color you are, what age you are. You know, it doesn't. But we have to take care of
There
ourselves.
is a little test that is so simply done called the Brock and Brack. And it
Yeah.
is a genetic breast cancer testing that I believe every woman should take. Because if you had a distant family member or your mother or a sister that didn't realize that where their breast cancer came from, that Brock and Brack will tell you whether you carry the gene. Doesn't mean you have cancer, but it'll show that you carry the gene, and that gives you the information to go from there on what you want to do with your body.
Any questions, thoughts, any afterthoughts?
This is something that I think Kim and I could talk about forever.
Yeah.
God, yeah.
And what I find interesting as we started talking, I think we all agree it's money,
Hmm.
slight politics
Yeah.
that prevent these things from moving forward. And it's
That's it.
very frustrating.
Yeah, money. And if it was, you know what they said, was it COVID? Not COVID. What's the blue pill?
Viagra.
Viagra.
Viagra, how that was discovered. Yes, yes. How was that discovered? And men, obviously, Congress, like, yeah, let's fund that sucker immediately. And you have the different brands and generic, and I guess it's all covered. Ain't that something?
It is now.
Ain't that
Mm-hmm.
something? Yeah.
It is now.
So
I
I
mean,
will go.
I'm fighting a medication right now that my doctor wants to put me on for a year. Oh, that's not enough information. Well, I don't know what kind of information you want. What do you think I just went through this last year? You know?
And it's your doctor telling, like, yeah, there's some crazy doctors out there, but listen to the doctor. If the doctor is saying, I want her to take this so it can help her, you shouldn't have to jump through hoops like this.
But would you say now it's like you always hear, is it PTSD? Do you have
Yeah.
to go through that? I mean, so you have the physical part. Then you also have the emotional and mental part. Did you have to go through that? Did you have obviously you said you have family or friends, but did you have to see a professional on helping you? Or is there someone that with you, a therapist?
Oh, I did. I did because in the beginning when you go through this, you've got everybody there. I'm going to help you. I'm here. I'm there. I'm that, and this and that, and it's overwhelming. And you got all this information, and then when you're right in the thick of it, like when I was going through chemo, everybody has to go back to their own lives.
Yeah.
Which is that's a normal thing. And then there you sit, and it's like I got out and walked every single day, just sick or not, I was still walking. But then there you sit, and then you start thinking, and you're like, "Holy shit, I'm going to fucking die! My
Mm,
God, what? How do I? Nobody's going to understand this." And even though your friends are there for you, but they've got their lives too. So
yeah.
Yeah.
I can't imagine going through this alone. Yeah, I can't imagine. Something that also occurred to me in my head was the fact that society puts a lot of pressure on. So you both having, the looks as far as, when you were a teen, a young adult, you wear the outfits that accents your assets, so to speak. And then when you're told that, you have a disease and stuff like that, does it affect in your mind like, oh my gosh, I'm going to lose my sex appeal? Does that come into mind? Because that was me.
yep, 100%.
Yeah.
Yeah.
Yeah. And again, at that time, I wasn't married. You know that. I wasn't married at that time. No, I mean, and it was in my head, I was thinking, like, will men be attracted to me? Will they notice? And when I met my husband, I got married, Michael, I got married at 42. And I had told him about, what I had gone through. And, I said, I have a lot of scars. They're my battle wounds. I fought for my survival. And if you're not okay with that, well, that's not going to change. This is who I am. And he was like, I agree with you. You did fight a battle. And with every warrior, they will have a scar to show that they came out on the other side. So that's why I've been married to that man for 16 years now.
Woo! Yes.
So, I was like, oh, I'll keep him around.
No, that's true, to be open and frank, because there's
I actually
emotional
have a friend
scars.
that I met that was dating a guy, and he told her how madly in love he was with her before she told him that she was going through cancer. And would you know that when she told him that she was getting ready to start treatment, he dumped her?
What?
Yep, he dumped her. I know, I'm still like in shock for her, but you know what? She came out on the other end pretty good.
Yeah.
So she's better off with
Yeah, he's not worth her time.
no, no.
She's something better is going to come to her, and
Actually,
she's going to be like, who was that?
yeah,
That's like
she has met somebody. So
you said that in an earlier segment that you know who your people are when your friends are there.
yep,
Hmm.
you do.
You do.
You know it.
You do.
Darren, did your husband still with you during this whole thing or no?
Oh, yeah. Yeah, Yep. And getting back to the thing you just said about like the your looks and this and that, I like with me, and I know this sounds vain, but don't take it that way because I don't mean it to sound that way. Like my hair has always been my asset. And so I chose to do what they called cold capping. A lot of the doctors will not talk about that because they feel like when you go through chemo, if you prevent chemo from hitting any or every part of your body, then you're setting yourself up. But like I have an estrogen progesterone based cancer. It's going to go to my liver or my bones before it goes to the hair follicles or my head. So I chose to cold cap. And that's another thing. Insurance doesn't cover it.
So
Some
it's
insurances will,
cosmetic.
very little will cover it. So you have to pay to do it. And it's not a guarantee. I mean, I did lose 30 to 40% of my hair going through it. And
It looked like it grew back.
it
Yeah.
Yeah, I'm like, I don't see anything.
no, it is. It's like if you felt, I had a big thick head full of hair anyway, but like now it's all, it's underneath and everything is like about, so long. But that's what I chose to do. And that's because that's all, but I lost my eyebrows, my eyelashes like 3 or 4 times, my body hair, like,
But physically, because you're back to work. So physically, you're able to. I remember texting you, said,
I'm
don't push
tired.
yourself. Are you
I'm
tired?
tired a lot.
Okay. Okay.
Mhm.
All
And
right.
and they told me even after radiation, that radiation can wear you out up to a year after. And I don't have a lot of upper body strength anymore because through my treatment, I didn't realize I was as heavy as I was, but I lost 40 pounds. And so I don't have a lot of upper body strength. So it's the negotiation of getting like commuting and getting my suitcase up in the overhead bin.
What was interesting? My sister shared with me that when she because of what they pumped her with all the chemo and stuff, that she said she was radiating that when even in her urine, that was also, I guess the chemicals in there that she's like, wow, she had to flush it twice, but she was so concerned that it'll expose the rest of the family. These are things I don't think about.
They did talk about my doctor never said to do that, but I in some of the cancer forums I'm on, I've heard that some of them said, "Oh, I have to use a separate toilet," or "Oh, this
Yeah,
or
yeah.
that."
Yeah.
Do you have Kim? Did you have radiation?
Was taking tamoxifen. I didn't because where it was located, they were able to remove everything. But for 5 years, I had to take tamoxifen. And I didn't have to do chemo, no radiation. But tamoxifen, it just, that was another thing too. It
I'm
just,
on what's called a Nestrozole, so I'm right with you.
yeah.
But I noticed, like with the radiation, that breast it stays hot.
Mm.
That
Yeah.
portion of my body is still kind of hot.
Like temperature hot.
Yeah, temperature hot.
So when you
What,
touch it,
what do you mean hot?
no, no, no. I'm just emphasizing. I'm like, what?
My
It's
boots are hot, baby.
Yeah, again, I'm learning. I'm learning. I'm like, wow, this is good. This is good. Interesting, interesting. Little things I didn't think about. I want to thank you both for including me in your journey. Each of you have taken part in letting me know, talking to me. That just says a lot about our friendships, and so that means a lot. Derrian too, especially recently. You since the beginning of the year, you were sharing your pictures, your thoughts, and I appreciate that very much because obviously I could not be there in person, but I love the fact that you were sharing your journey with someone, like you said, a friend. And I'm glad that things went through and succeeded. And Kim, of course, such a long friendship that we've had for such a long period of time. If there's anything I would love to say, just thank you for being part of the Kuka for Politics podcast. And as always, appreciate you both. And ladies and gentlemen, stay tuned for my closing thoughts. As I wrap up today's conversation on Beyond the Pink, I'm reminded that breast cancer is not just a medical diagnosis. It's a deeply human journey. Our two guests, one who's 25-year survivor and the other newly navigating life after treatment, both demonstrated what strength, vulnerability, and what resilience truly looks like. Their stories highlight the importance of knowing our own bodies and practicing consistent self-care. Early detection begins with awareness, listening to what your body is trying to tell you, and not ignoring the signs because of fear, inconvenience, or uncertainty. They both remind us that no one should walk this road alone. Sometimes the difference between breaking down and breaking through is having someone beside you, whether it's a friend, a colleague, a loved one, a hairdresser, someone to walk with you every step of the way. We also confronted the harder truths. Where you live in this country can mean the difference between immediate attention and endless waiting. A survivor treated 2 decades ago in New York had access to rapid and quality care, where my recently diagnosed guest who resides in Florida had to fight for every referral, every appointment, and every piece of information. Geography, insurance networks, and provider shortages create barriers that no patient should have to overcome while already battling cancer. Both guests are professional flight attendants, and they shed some light on an issue that often goes unspoken: how constant exposure to radiation, disrupted sleep patterns, and the physical stress of airline life could put aviation crews at greater risk of cancer. It's a reminder that occupational health is healthcare too, and that employers, unions, and policymakers must take these risks seriously. We also discussed fear, how fear itself keeps people from getting screened, and how the structure within the US healthcare system often magnifies that fear. The Affordable Care Act, also known as Obamacare, has expanded preventive care for millions. But at the time of this recording, its future again is being debated. If protections lapse, that would mean less accessible care, premiums may rise, and people may delay their care until it's too late. Meanwhile, other nations treat healthcare as a fundamental right, not a privilege tied to employment or income. Yes, disparities persist. Black women, unfortunately, are less likely to be screened early and more likely to face delays or misdiagnosis. But in this conversation, made it clear race is not the only factor. Your zip code and access to specialists can be just as consequential. Insurance companies often dictate medical decisions meant to be made by doctors and their patients. But when insurance companies getting in the way, it's creating a burnout in the profession and deterring next generation of medical providers. Another blow that will have a negative impact on the future generation of medical providers, particularly in the profession of nursing, is in Trump's big, beautiful bill, in which the administration has deemed nurses no longer professionals. What does that mean? It means those individuals who are applying to be a nurse are no longer eligible for certain educational loans, which will add another financial burden to students or deter them from the profession altogether. And that's a conversation in itself. Through all that, the message our guests brought forward was this: hope, faith, and community and sisterhood has carried them through these darkest moments. They opened up about the emotional weight of losing or potential losing part of what society often defines as femininity. Breast cancer isn't only a physical battle, it touches on identity, sexuality, confidence, and the way a woman sees herself. Fortunately, advancements in reconstruction and recovery continue to give survivors more options and more control. And one more truth we cannot ignore: men get breast cancer too. Awareness isn't only a women's issue. Husbands, fathers, brothers, sons must know the signs and support the women in their lives through education, advocacy, and empathy. So I close out with today's word, this. I want everyone to leave with this: prevention is power, knowledge is power, Support is power. Hope is a heartbeat that carries survivors forward. If you're listening today, do not wait. Know your body. Get screened. Ask questions. Demand care. And support the people in your life who may be carrying fears you cannot see. I want to thank you for joining me in this conversation beyond the pink. I ask that you stay informed, stay proactive, and above all, stay hopeful. This is Michael, host of the political podcast, Kuka for Politics. Thank you for listening. Until the next episode, stay blessed.